for many women, the journey to motherhood begins long before a positive pregnancy test. From understanding your menstrual cycle to optimizing your nutritional and mental health, a lot goes into conceiving and delivering a healthy baby.
And to talk about the beginning of that journey to motherhood is Dr. Hack. Dr. Hack, thank you for joining us.
Thank you for having me.
So we're talking about preconception health. What should a woman who's planning on getting pregnant, what should she do? What should she know?
Oh, there are so many things. But first off, the goal is to be as healthy as you possibly can be prior to getting pregnant. And that means knowing your medical conditions and optimizing your health.
And what does that look like, optimizing your health?
Sure. So usually that's going to begin with a conversation with your healthcare provider. And in that conversation, you're going to review your medical history, which includes any medications you're taking, any conditions you had, any previous pregnancies that you've had, and the outcomes of those pregnancies. Also your family history and understanding, is there maybe a condition in my family that could potentially affect me and my pregnancy? So it's going to begin by reviewing all of that information and then having a conversation with someone who can kind of help you pick out the important things to focus on.
Should the father be part of that conversation as well?
Yes, because some of these genetic conditions are going to be from the father, not just the mother. And it depends. You can be a carrier, but some things are going to be dominant and provided by one or the other.
And could you talk about maybe some misconceptions that are out there that are said women need to be doing, but in reality they don't need to be doing?
I think it's more like there are things that people need to be doing that they don't necessarily realize they should be doing. For example, you want to start a prenatal vitamin. That is very important. We want to make sure that you have the appropriate nutrition. Well, most people do because we generally have most of these things in our diet, but there are things like folic acid that women should be consuming at least 3 months prior to pregnancy.
That's really interesting because women are told to take prenatal vitamins during their pregnancy, right?
Yes.
But you're saying even before.
Even before, it's ideal to start before.
Wow.
So how soon should one get prepared, get ready?
Sure. So you want to ideally have that conversation, if you can, a year before getting pregnant. But up to 50% of pregnancies are unplanned. So that's not realistic. But if you know, hey, I think I might want to get pregnant, or I'd be open to getting pregnant within the next year, ideally having the conversation and kind of figuring those things out at that time is ideal.
Other than the obvious, what role should men play in this?
Yes, so they want to make sure that they are aware of everything that's happening because they're contributing, right, to this child. But they also need to be healthy. There's some concern about substances that can affect their ability to impregnate someone. So they want to limit their substance use, optimize their health as well. Those things are just as important as the woman.
And what do you say to women who are a bit overwhelmed with everything she has to do to prepare her body for pregnancy?
Yeah, I'd say just thinking about how can I eat healthy and have great activity levels. I think that's like a very good first start. If you start there, and then you also want to get an idea of how long you've been trying to get pregnant or how long you've been trying to get pregnant. So that way, if for some reason it's taking longer than expected, you know when you need to start having additional conversations with your healthcare provider.
How about nutritional do's and don'ts?
Sure. So ideally, you would like to decrease your alcohol intake. Of course, that would happen when you get pregnant. But if you're, for example, overusing alcohol or using some other substances, those are things that you want to cut back on and stop using altogether, ideally. I'm not alcohol specifically, that we want to decrease your usage. You don't have to stop drinking if you want to get pregnant, but you should know how often you're using things and ideally cut back because you want to be your healthiest.
But once one is pregnant, no alcohol.
No alcohol once you are pregnant. But when you're trying to get pregnant, we don't say you can't drink. But if you're drinking a lot, you definitely want to decrease that because that can affect your ability to get pregnant.
And women who want to work out, I know I'm assuming by case basis.
Yes.
Can you talk about that?
Sure. So most of the exercise recommendations are that you can continue to maintain the same activity level that you had prior to pregnancy, during pregnancy. Now, there are some things that you are not recommended to do, like kickboxing or scuba diving or skydiving or horseback riding, you know, things like that. But in general, you know, I was lifting weights and squatting like 200 pounds at 36 weeks. If you are able to continue that from before pregnancy, that's generally fine. But again, it's case by case, and it's in consultation with your healthcare provider.
Okay. All right. Well, thank you, Dr. Hack.
Thank you very much.
You're welcome.
And for more information on women's health and Dr. Hack's podcast, visit ladypartsdoctor.com.